When should I start looking into Medicare? This is a question we hear all the time from people who are close to age 65. Medicare is complicated, and how and when you enroll will depend on your unique situation. Whether you will continue working once you're on Medicare, what, if any, group health insurance might be available to you, whether you are going to start taking Social Security at age 65, and the list goes on. In this video, we'll discuss the ideal, realistic timeline to get you prepared for Medicare with the least amount of stress and confusion possible. Hi, I'm Tabitha Moldenhauer, broker with Benefit Consultants Midwest. If you haven't already, please take a moment to hit the subscribe button. We have new, helpful Medicare content every week. Here's the most important thing. Don't wait until the last minute to enroll in Medicare itself. And by that I mean Medicare Parts A and B. You can apply for Medicare Parts A and B online at ssa.gov/benefits/Medicare. You can also call Social Security or apply at your local Social Security office. For many people, applying any of those ways goes fairly smoothly, and they are assigned a Medicare ID number, and a Medicare card arrives in the mail in about 30 days. However, sometimes the enrollment process does not go smoothly at all. Recently, clients have had significant delays applying for Medicare using all three of those enrollment options. If you can't log into the Social Security website, a card with an activation code will be mailed to you if you request one, but that takes about 10 days. Both the phone centers and local offices in some locations have been experiencing long wait times for appointments due to staffing shortages and the pandemic. Because having a Medicare ID is the first necessary step before you can enroll in any other kind of Medicare coverage. If you wait until the last month before you want your coverage to start and run into any kind of delay, there's a good chance you won't have everything completed when you'd like. So if a month isn't enough time, when should you start? The ideal time to start learning about how Medicare works, what your coverage options are, and when you should enroll in what is 3 to 6 months before your Medicare eligibility. This isn't to say that all of your time should be spent learning about Medicare. That could drive you insane. By starting early, you can avoid potential Social Security office delays and break your Medicare learning into small chunks. We have a simple checklist to follow that can help. A link to it is in the description below, and more information about it is in the video linked above. Although all the enrollment rules for Medicare and Medicare plans are publicly available, Medicare doesn't guide you through them or give you specific instructions that are tailored to your particular situation. For most people, the most important time for making decisions about your Medicare coverage is the 7-month period surrounding the month in which you turn 65. The 3 months before your birth month, and the 3 months after your birth month are your initial enrollment period. If you want your Medicare coverage to start the first day of your birth month, you have to apply before your birth month. That's the government side of things. Medicare was never intended to cover all of your medical expenses. Because of that, most people also enroll in coverage beyond Medicare Parts A and B. By that, I mean Medicare supplements or Medigap plans, Medicare Advantage plans, and Medicare Part D plans. All of these are offered through private insurance companies. Medicare has rules governing when and how you can enroll in each of these plans too. The rules are not the same for every type of plan. With a few exceptions, the two major routes that a person can take for individual Medicare coverage are either a Medicare Advantage plan that includes Part D drug coverage or a Medicare supplement plus a standalone Medicare Part D plan. To be able to decide which route is best for you, You have to take a look at what is available where you live and which type of plan best fits your medical and financial situation. The video linked above and in the description below explains in more detail the differences between Medicare supplements and Medicare Advantage plans. Once you've decided which type of plan is best for you, you can start comparison shopping all of the plans available from all of the insurance companies offering those plans in your zip code. Then in the future, if you are covered by a Medicare supplement, you can comparison shop again every time that rates change. Or if you are in a Medicare Advantage or a Part D plan, you can comparison shop every year during the annual enrollment period between October 15th and December 7th. You can do all this on your own, but you don't have to. And really, I don't recommend that you do. The great thing about the internet is that anyone can put content here. Also, the bad thing about the internet is that anyone can put content here. A lot of our time on the phone is spent debunking incorrect information that people found when they were researching Medicare plans on the internet. Plenty of people who are very successful and brilliant in their own fields of specialty have gotten themselves into really tight spots with Medicare by relying on information they found online that turned out to be confusing, misleading, or just flat out wrong. If you see something online that claims to be a way to get around late enrollment penalties or income-related monthly adjustment amounts or anything secret about Medicare that they don't want you to know, it's probably not correct. Any statement online made about Medicare or Medicare plans should be verifiable on Medicare.gov or your state's health insurance department's website. And if a Medicare plan broker can't back up what he or she is telling you with documentation, find a different Medicare plan broker. Honest, reputable Medicare plan brokers are here to help you every step of the way, from learning about Medicare to answering your questions, to enrolling in Medicare itself and Medicare coverage, and then changing or renewing those Medicare plans in the future. We do this all at no cost to you. If you enroll through our office into a plan offered by any of the many insurance companies we contract with, we receive a commission for your enrollment. Because the commissions for Medicare plans are about the same regardless of which plan or company you choose, we can be impartial when comparison shopping plans and put your best interest first. The price is the same for you whether you purchase a Medicare plan direct from an insurance company or through the office of a Medicare plan broker, so why not take the extra free assistance? If you have questions about Medicare coverage, please feel free to give our office a call at 877-312-1414 or visit bcmwi.com. We're here to help take the confusion out of Medicare and find the best Medicare plans for your unique situation and hard-earned dollars. Have a great day.